Friends of the media, thank you for coming to the press conference. My apology that we are starting 10 minutes late. Sorry for keeping you waiting. The Chief Executive will first say a few words and then she will take questions from the floor. Now, can I invite the Chief Executive to speak? Friends of the media, members of the public, let me first of all give you an update on the latest situation. According to the Center for Health Protection of the Department of Health, as at 9 a.m. today, around the world, there are at least 175 cases of novel coronavirus infection. We notice that the outbreak is continuing on the mainland. The number of cases continues to climb. According to the National Health Commission, as at midnight last night, on the mainland there are in total 324 cases, an increase of 3,887 cases. Of those cases, 16,678 cases are in Hubei province. In Hong Kong, we see a worsening trend too for the outbreak. Today and yesterday in Hong Kong, there's an increase of 6 additional confirmed cases. As at 3 p.m. today, there are now 21 confirmed cases. For the 3 new cases yesterday, during the incubation period, the patients did not travel outside of Hong Kong, and there is no obvious source of infection. So these 3 are locally infection cases, and they cause a concern because it shows that maybe in Hong Kong there's already community transmission. So in the next 14 days, it is crucial period to stop the spread of the disease in the community. And the second update is among the 21 confirmed cases, one of the patients' condition worsened suddenly yesterday morning. After resuscitation, he could not be saved. Now, that patient was in stable condition all along until yesterday morning. All of a sudden, his condition worsened, so the doctors are unable to explain the cause of his death. That's why the case has been referred to the coroner. And at the moment, there are still 2 patients in critical condition. Now, the strategy of the SL government in controlling the outbreak has always been to prevent and to reduce the transmission of disease. But we will have regard to the latest developments. We will consult the experts, and then we have regard to the actual situation in Hong Kong and make corresponding adjustments. Now, yesterday, there have been 3 new locally infected cases, so the outbreak has reached another critical phase. The government needs to take even more stringent measures and work together with the community to slow the spread of the disease. Yesterday, I invited the 4 experts of the expert advisory group to give me their views. Today, I will announce further measures to compress the flow of people across the border. Before I announce the new measures, I'd like to report that yesterday, the 4th of February, we suspended 4 more boundary control points, so I would like to report to you the effect. Now, on the 31st of January, we suspended 6 border control points, and then yesterday we suspended 4 more. So this further suspension has seen great results. Now, I'll give you a comparison before and after the implementation of the measure. That is, we'll compare the figures for yesterday, the 4th of February, to the figures for the 3rd of February. The first figure is BC control points outside of the international airport, total number of arrivals. As you know, there are just 2 BCPs left, the Shenzhen Bay port and also the Hong Kong Joy Macau Bridge port. On the 3rd of February, before the implementation of the additional measures, arrival number was 78,354. Yesterday, since the new measures took effect, there's a drop of 64%. Total number of arrivals is total number of people going through the borders is 28,675. And that figure is for the airport. Before the measures, 52,050 people. After the implementation measures, 41,137 people. So a drop of 21%. But then for most of the travelers going through the airport, they do not come from the mainland. They are international travelers. But then some say in the community that no, it's not true. There are several thousand mainland visitors at the airport that they saw. So I'd like to analyze the figures with you. For airport arrivals coming from the mainland, in other words, people who hold Chinese passport, there were 6,039 people. This is the figure for yesterday. But then the Immigration Department conducted detailed analysis on the figure. We found that for people who came in from the mainland on a flight, the number was just 224. That is mainland visitors with Chinese passport coming from mainland airports. Number was 224, accounting for 3.7% of the total number of arrivals. For many other Chinese visitors, they not holding Chinese passport, and they did not come from mainland. They came from various other cities around the world. And the third set of figures. Now there are only two remaining control points. Before the start of the measures, the people coming back from the mainland was 69,822 yesterday, 23,643, so a drop of 66%. Now, remember, every time we talk about arrival numbers, we also need to consider the exit numbers, and that's very important for the control of the disease. Here we're talking about Hong Kong residents leaving the land crossings to go to the mainland. Now, that is significant because we believe for most Hong Kong residents who leave Hong Kong will come back to Hong Kong soon, sometimes even on the same day. So that's why this figure is important in terms of the control of the epidemic. Now, before the implementation of the measures, I told you the figure was high, 41,031. After the implementation of the measure, that's yesterday, again, that's a significant drop, 14,218, a drop of 65%. So the figures will go down further as there is stronger awareness among the public to prevent the spread of the disease, and also because we are reducing further public transportation services. But then, having considered the latest situation, since there are still some 28,000 people coming from across the land borders from the mainland, we need to take further measures to compress the number. Now, at the same time, also, there are still some 14,000 Hong Kong residents going to the mainland every day. Again, there's room for further reducing that figure. As we take additional measures, we must bear in mind the fact that more than 80% of the arrivals from the mainland are Hong Kong residents. We cannot refuse them from entry back to Hong Kong. Now, if we look at the percentage, for the past 4 days, that has been consistently over 80%, from 82 to 88% of the total arrivals, which are Hong Kong residents. So we've had regard to the latest developments of the outbreak and the actual needs for Hong Kong. So I now declare that the Chief Executive in Council will invoke the Prevention and Control of Disease Ordinance, CAP 58899. We will invoke the powers to enact substitute legislation for people coming from the mainland, including Hong Kong residents, mainland residents, and other visitors. They have to go into compulsory quarantine for 14 days. At the meeting of the Executive Council yesterday morning, it was agreed in principle to adopt this measure. So this is the second time that we're invoking this ordinance for the prevention of and control of a disease. On the 8th of January, we included the novel coronavirus as a reportable disease in the reference schedule of the substitute legislation. It was the 8th of January, note that. So we already put in place a relevant legislative measure early on. Now, this is the second time we're invoking the ordinance since As for the details of the subsidiary legislation and the quarantine arrangement, the Food and Health Bureau and the Revenue Departments will be making announcements. So we hope the measure will come in place at 0 hours on the 8th of February, because we need to first deal with the legislative exercise. But what is important is that for those who may be affected, they will have from now for 2 more days to make the necessary arrangements. Now, this is very strict measure. You can imagine for people coming from the mainland, if after they cross the border, they have to be put into compulsory quarantine for 14 days, unless they must absolutely come to Hong Kong, they wouldn't come. And for Hong Kong residents, if they know that after they leave Hong Kong and then if they come back, they will be put in under quarantine for 14 days, then again, they will not just casually leave Hong Kong to go to the mainland. Now, there's already a significant drop in the in people movement, so we believe there will be a substantial drop in cross-boundary transport services. I understand the Cathay Pacific and Dragon Air, the subsidiary of Cathay Pacific, are already reducing the number of scheduled flights between the mainland and Hong Kong. They are only flying to Beijing 2 flights a day, Shanghai 2 flights a day, Xiamen 1 flight a day, and Chengdu 4 flights a week. So that's a reduction of 90% in their flight services. Similarly, for cross-boundary bus services and other public transport services, also public transport services to Shenzhen Bay Port, there will be corresponding adjustments of these services as well. And then the government will immediately suspend the port services at the Kai Tak cruise terminal and the ocean terminal. Today, there's some cruise ship that's docked. The Director of Health will brief you on the latest situation about this cruise ship. Now, we want to effectively reduce the community transmission, so we need to do more in social distancing. Now, there are various effective measures in place: class suspension, work from home, suspension of certain public services, cancellation of social events, and advising the public to refrain from going to crowded places. Now, here I would like to strongly appeal to the public again to support all these measures. Businesses must exercise flexibility with the work arrangement of their staff. Members of the public should stay home unless it's necessary. And if they need to go out, they need to observe all personal hygiene measures and take precautions. And if necessary, they should wear a mask. Now, on what I said yesterday about a face mask, because I didn't make myself clear and I caused misunderstanding, I must apologize now. What I wanted to point out was that the government would like to give priority to healthcare workers and frontline staff who need face masks. That's why we will have certain assessment criteria in deciding whether officials will wear face masks on a public occasion. Who I was talking about were mainly government officials. I was just saying they should set an example and reduce the use of face masks unless absolutely necessary. Now, of course, with these additional measures, many people will be affected in Hong Kong. For example, today there are people who need to travel across the border to go to work. I have asked the Secretary for Labour and Welfare to come up with a plan as soon as possible so that for affected employees and employers, they could be given assistance. The SAR government will also set up a fund of more than $10 billion. It will be a fund to fight the outbreak. We will announce the details later. And also, because of the economic downturn, and the government has already announced a package of relief measures. We'll consider extending the validity of these measures and even expand the scope. As for shop operators who may suffer, I would like to appeal to landlords to offer assistance to shop operators who may be affected, so we could fight this together. Now, In the light of this outbreak, the government has always remained on high alert. We want to protect public health and public safety. We also want to maintain social stability. Those are the principles we go by. We've listened to the views of experts and health care officers with regard to the actual situation in Hong Kong, with regard to various aspects, and then we've devised our strategy to fight the outbreak. Now, we are trying our best to reduce people movements across the border and social contact. But then in terms of the economy or day-to-day, well, there are strong economic ties and social ties between the mainland and Hong Kong. So if we try to completely cut the flow of people between two places is not practical. And also people are very much concerned about the supplies of daily necessities. In 1 week, we have announced 3 rounds of measures to control the border, and that would substantially reduce the number of people going across the border and reduce the risk. And today, in the light of the latest development and the data, we are announcing further measures. In the light of the latest developments of the epidemic, we will tread with caution in responding to it at every step of the way. Now, in Hong Kong, we have a robust healthcare system. We have excellent healthcare workers. We have community with a high awareness to prevent the disease. So we must now all work together towards the same goal. Let's put aside our differences, and then together we can overcome this challenge as one. Now I'll invite the Director of Health to give you more information on the cruise ship that's docked at the Kai Tak Cruise Terminal. Dr. Chen, please.
Today, the Port Health Division had visited the Kai Tak Cruise Terminal to conduct investigation. Well, a cruise ship on 19th to 24th of January, this cruise ship will have a group of passengers that set off from Nan Sha to Vietnam. We're notified that some of the passengers, 8 of those, have been diagnosed with novel coronavirus. And these passengers have concluded their trip, and the Hong Kong is their home port. Thus, the port health officers had went to investigate, and prior, we request all the crew members and passengers to fill up the health declaration forms. From what we know so far, there are 1,800 plus passengers. Over 90% are Hong Kong residents, with the rest of other nationalities. From what we know, there are no mainland passengers, and there are also over 1,800 plus crew members on board. And now, I pass over to Dr. Leung Yu Hong, Chief Port Health Officers, on the latest update and investigation. Allow me to provide more information. That cruise ship on 19th of January have set up from Hong Kong with 206 passengers on board. On the same day, they arrived at Nan Sha, where they have 4,480 passengers entered the ship, and over 4,600 passengers then went to Vietnam. And on 24th of January, this cruise ship returned to Nan Sha. And on the 19th, out of the 4,400 mainland passengers have all been disembarked at Nam Sha. This cruise ship then arrived at Nan Sha, and on the 206 Hong Kong residents had disembarked on 24th of January in Hong Kong. Like Dr. Chen said, the ship currently docked at Kai Tak Cruise Terminal with over 1,800 passengers, with a majority of those Hong Kong residents. Of these group of passengers, there or no direct exposure or contact with the 8 confirmed cases. And for the crew members who have been in touch with these 8 confirmed cases, had already disembarked on 24th of January. Allow me to say what the Port Health Division have done. Upon receiving notification this morning, the Port Health Division have dispatched a team to enter the cruise ship and had notified the cruise ship without the authority of the chief health officers. All the crew members and the passengers were not be able to disembark. Our investigation is still ongoing, so as of this moment, there are no crew members, no passengers able to disembark. So I will provide more details later. When we entered the ship, for every passengers and crew member, we will collect the health declaration forms and also do some body temperature checks. So we're mainly helping with the crew members first. So we shall help take the body temperature of the 1,800 plus crew members first. So there are about over 30 crew members state in their health declaration forms claim they have shown symptoms, and 3 of those claimed they had a fever, and 1 of those claimed he had a fever, and with the collected specimen have tested positive to the influenza B. And however, out of prudence, we have put the 3 crew members with the authority of the port health officer. We allowed them to disembark and had sent them to the United Christian Hospital and the Prince of Wales Hospital for isolation and testing. Our investigation is still ongoing. And for the other 27 crew members who had shown minor symptoms, so they're just mostly coughing or sore throat. Our colleagues are currently helping these 27 crew members to collecting their specimens. Then this specimen will be sent to the Public Health Laboratory under the Department of Health for testing for the novel coronavirus. As I mentioned earlier, on 24th of January, there are about 206 passengers that might be in contact with the confirmed cases. They already disembarked at Hong Kong. And we already obtained the contacts of the 266 persons from the cruise company. And we will conduct the contact tracing as soon as possible. Based on a risk assessment, and with the 8 confirmed cases, and quite a few number of crew members had shown symptoms, acting out of prudence, we see, even though the investigation is ongoing, based on the result on the specimen we collected and the course of its epidemiological investigation in deciding whether port quarantine measures, we won't rule out in putting the entire ship under quarantine. Now is the time for question. May the reporter state the name of the media before asking your questions. And HK01. Yesterday, you claimed that you have issued internal guidelines, and for those on the front line or those going to private places, allow them to wear counters so that they can conserve face masks in setting aside for the healthcare staff. And yes, the cluster controller of HA claimed that they have never received the face mask manufactured by the correction service industry. As for them setting aside the face masks, where did they go, which department are using them? And you explained that your yesterday remarks asked the principal officials to lead by example to cut down on usage and based on the risk assessment. And why some of the officials present today are not wearing while some are not. So what is the criteria? Would you worry that in asking the civil servants to cut down on the usage would lead to the backlash from them? And also, would you consider distributing government's face mask reserved to the public? because some of the elderly and the chronically ill have ran out of face masks. Would you consider giving them first for their urgent need? I suppose that's be it. Allow me to answer some of the questions. On the overall mask supply, I'll let Mr. Edward Yao to supplement. First, the Correctional Service Department is one of the places that manufacture surgical masks. Well, the production volume is quite low, even though we've asked them to enhance production. So in the past, these CSD mainly supply other departments, with some of them to the NGOs for ordering. Well, in the TMHK Facebook page, we have disclosed the figures. When we said that we hope to conserve on the face masks and setting aside more for the healthcare workers, these also include those working in the government and those needing them on the front line for the providing medical services. If you look at the tight supply situation, when the hospital authority ordering them for the healthcare workers, well, we see them as a whole instead of just the health allow the hospital authority to order on their own. It's a very tight supply globally and also in the mainland. So the whole, we see it as for the whole public sector as a whole. As for the private sector, if they have logistical challenge or custom clearance issue, we will try to assist them. If we try to cut down on the usage for the public sector as a whole, which would allow more HA staff and also frontline medical workers and use more of those. On the other hand, we're very cared about the disadvantaged and the elderly and those in the residential homes and the carers. We also encourage the charities and also with some donation, we suggest you should donate them the disadvantaged groups instead. And now I'll pass over to Mr. Edward Yao to talk about the details. Thank you, Chief Executive. The public has a very keen demand for face masks, and we quite understand, and also the anxiety arising. And I'd like to see is that in response to this reporter's question, as for the supply of protective equipment, the government had did a review. That would do that with the HA. Since after the Chinese New Year, the global demand for this protective equipment have been very strong. And in some foreign countries, and some of those had imposed export control, thus either from procurement, either by HA direct ordering, or through the government logistics department. The traditional way of tendering is not working. Thus, we proactively contact including the mainland and overseas suppliers, hoping to order them directly. So we do that with the hospital authority in this. For the demand for hospital authority, especially the frontline healthcare workers, and also include the Department of Health frontline, their demand for the protective gear had risen by tenfold. That's reasonable because they do need them to do their work and also protect themselves and the patients. Thus, we are actually on a united front on this. The key, like the CE said, whatever we bought, we will give priority to the frontline healthcare workers, whether they work under the HA or the Department of Health. We also understand that the procurement situation, with a tight situation everywhere, and with the prices have risen quite a bit. However, we try to cast a wider net. Besides the government doing their own procurement, we also work with the business sector, the importer and exporters. If they have placed their order, and especially the mainland, they're ready to deliver it. And however, due to various reasons, they come into problems, and we will work with them on the customs and excise department level. And after the Chinese New Year, we had seen some kind of supply able to resume entering Hong Kong. Well, in the long run, we need to do more. However, we regularly contact the mainland manufacturers to see if they can secure their supply to Hong Kong, and we need to deal with on the central government level. Well, for the mainland situation, their demand for this kind of supplies are also as keen as us. Well, so some coordination must be done, and we're still working on it. And for the Hong Kong retail level, we have discussed it with retailers. So when the stock arrived, well, we should try to sell them in a more convenient way. So we'll be working with these suppliers and the retailers on discussing this. And finally, more recently, there are claims that whether Hong Kong can do some smaller scale and sustainable local production. So I've been working with the Productivity Council to pass on some basic information on the production line as well the necessary conditions and consolidating such information, and we will discuss them with the and also study that with some interested local manufacturers. This is actually difficult, however, we shall work along the direction I've stated.
Next, the one in green, please. Good afternoon, I'm from Metro Radio. First, just now it's mentioned that in a short space of time, there have been quite a number of locally infected cases in Hong Kong. It's only today that you decided to have to impose compulsory quarantine on mainland arrivals. Do you think it's too late? Do you have to show the responsibility for not doing enough to protect the people of Hong Kong? Another question is on compulsory quarantine. Now, some people may not, for people coming to Hong Kong, they don't have maybe a place of abode. And if they all go to quarantine camps, do you have enough room for all of them? I'll ask Professor Sophia Chan to take a second question. But as I said in my opening remarks, we're still drafting the relevant subsidiary legislation. So we may only be able to brief you on the details in the next 2 days. But then perhaps Professor Chan could tell you about the initial ideas about the quarantine arrangement. Now, as I said, our strategy has always been to try to reduce the spread of the disease, and we've been following closely the developments, and we've consulted expert advice, and then we've had regard to Hong Kong's actual situation to adjust our measures. As you can have seen, we have frequent adjustments of the measures. It's because of the developments. And then we want to respond quickly to such developments. Perhaps the Director of Health could also say something in a moment. Now, for the strategies, we adopted a scientifically based, and then we also consider expert advice. So from the point of view of public health, whether these measures are the most appropriate, perhaps I should leave it to the expert. First, I'll invite Professor Chan to answer the part of the question about the framework for compulsory quarantine. As for the details, as I said, maybe we have to wait 2 more days perhaps, and then we could give you the full details. Thank you, Chief Executive. Just now the CE mentioned that there will be a legal framework starting from 00 hours on the 8th of February for all people arriving from the mainland through any ports, and regardless of whether they are Hong Kong or non-Hong Kong residents, they must all go into compulsory quarantine for 14 days, and during the period they may not leave Hong Kong. Now, of course, if they've been to the mainland 14 days before arriving at Hong Kong, that means that there must be compulsory quarantine. But I must stress that this is just a framework. We will have to give you the details later. For these people arriving at Hong Kong, they must still do health declaration. There will still be body temperature checks, and then we must make sure also they don't have any symptoms. For this novel coronavirus, is a new microorganism. At the end of at the end of last year, when the Hong Kong SL government learned from that in Wuhan there's this unknown pneumonia, our experts already got in touch with the Wuhan experts. Initially, there was limited information, but then there was much collaboration internationally among experts. Now we are getting more and more information on the virus. So therefore, as we get to know more about the virus, there will be changes in the prevention and control measures. Initially, on the mode of transmission, the incubation period, and whether asymptomatic patients during the incubation period may still spread the disease, and also human-to-human transmission. As you would recall, our experts have gone through various channels to obtain more information on that. And then, in the light of the information, we would adjust the prevention measures. Now that we have more information on the virus, we know that there could be community transmission by asymptomatic patients. That's why experts have reminded us early on, and also the WHO has said that in different parts of the world, it is not unexpected that there will be locally transmitted cases. That's why the whole of Hong Kong must join hands to fight the disease. Now, personal hygiene is important, as we know that from some studies on the mainland, the disease could spread through poor hygiene, so that's why personal hygiene is important, especially hand hygiene. Also, we know that now from patients' feces, there could be the virus too. So that's why after we use the toilet, we must first put down the seat cover before flushing the toilet. And also, for the U-traps at home, water must be added. So we must all step up such measures, and in our day-to-day habits, and we must make new habits, and also environmental hygiene wise we need to do something. Thank you.
Thank you. Hello again, Mrs. Lam. John Ray from ITV News, ITN of the UK. Could I ask you please to answer this general political question? Aren't you open to the accusation of always running behind this outbreak, that if you'd had acted sooner, then Hong Kong would have been safer? And how worried are you now that the direction of this outbreak in this territory might end up with Hong Kong being in the same kind of isolation trouble that the mainland of China is? 2 American airlines have already cancelled flights. Taiwan, the Philippines are closing their borders to you. So how worried are you that this might well end up with Hong Kong in isolation? Thank you.
Well, first of all, John, I've said in my introductory remarks, since we were first notified of this virus in the last month or so, we have been very vigilant in monitoring the situation, taking into account the advice of my in-house experts as well as external experts who were subsequently appointed to the Chief Executive's Expert Advisory Panel towards the latter part of January. So we have taken into account all these factors in making sure that the strategy remains one to prevent and to reduce the chances of this infection in Hong Kong, and also to adopt the measures which are most needed at every stage of the situation, because the situation changed, as the Director of Health has just explained to you. So it is not entirely appropriate to say that one was behind or one was ahead of the various timelines in order to introduce the effective measures. The second thing is about whether I am worried or we are worried. I suppose everybody in Hong Kong should be worried about the situation in Hong Kong. So in my concluding remarks just now, I made a strong appeal that first, let's have confidence in Hong Kong. We have a very robust public health system. We have excellent medical and health personnel. I should add that we also have adequate public resources. And we have a population which has gone through several of these infectious diseases. So they should be more alert to the various precautionary measures that the Center for Health Promotion has asked them to comply with. So this is a time really for social cohesion, for getting our act together in order to fight this disease. One of my expert advisors was a former Assistant Director General of the World Health Organization, Professor Fukuda. In my meeting with him over this period, especially yesterday, he made this a very strong point that in every society, every community, in order to combat a public health crisis, it requires society to put aside their differences in order to act together. You can imagine if we roll out one measure after another, including controlling the border points, reducing traffic, or now going for mandatory quarantine, if members of the community refuse to comply or refuse to adopt the various precautionary measures and still want to go out and interact, that would create difficulties for our fight against this disease. I remain optimistic that with the favorable circumstances, the experience that we have gained in the past, that we should be able to fight this together. But here I make another very sincere appeal that this is really the time for us to put aside our differences, to act together in order to overcome this public health crisis.
Let's take one more English question first. Howing away.
Mrs. Lam, do you think that your way of tackling the virus is more reactive than proactive and preventive? And how exactly are you going to quarantine potentially tens of thousands of people coming back from the mainland? And why do you think that this would be a more effective and feasible way of tackling the outbreak of the virus than closing the border completely? And secondly, just yesterday you said that officials can only wear masks when necessary. And I see that some officials present here today are wearing masks and some are not wearing masks. Can you explain why?
Well, I forgot to answer your second question when it was asked by another reporter friend here. Well, in our internal guidelines, and also in guidelines issued by the World Health Organization or by our own Center for Health Protection, there are circumstances which individuals are advised to wear surgical masks. So it is not a complete ban on wearing of masks. So there are circumstances that the advice is to put on a surgical mask, including if that individual is unwell. I'm sorry to see that several of my colleagues are unwell. And of course, there may be a case that because they are in frequent interactions in a health setting. So even if they are not unwell, because I'm not checked Dr. Leung whether he is unwell now, that puts him into that sort of circumstances that he should wear a surgical mask. So I think we are acting consistently with the guidelines that we have adopted, not only for the government, but for the general population. The first question about the way that we are tackling this public health situation. As I've said, the public health situation or this virus infection situation is evolving all the times. It started off with something which is entirely unknown. So even in early January, when we amend or when we made a regulation under the Prevention and Control of Diseases Ordinance, we didn't even know that it is coronavirus. We just put in a term to try to describe this very unknown virus that was hitting on the mainland of China and also Hong Kong and other places all over the world. So the situation is one that is evolving. So our strategy is really to monitor very closely the situation, taking into account the scientific evidence, the expert advice of my in-house colleagues as well as external experts, and to devise the most suitable strategy and measures that will help us to tackle the situation. And we have not shied away from introducing these effective measures. So you may remember that on one occasion, I think 2 days ago, I said you should not be surprised if you would be seeing me again within a very short period of time, because we need to have a speedy response to the changing circumstances. So I don't want to particularly describe how well my government has been doing, but certainly we are acting in accordance with a strategy which is to protect the safety and the health of Hong Kong.
下一條，前面呢位。
Next question. Cable news. So for those who need to go under quarantine upon return to China, can you disclose more details? I suppose the public is quite worried that upon implementation, how many of those will be quarantined? I could see there are over 10,000 people entering out of the border. Would you be able to cope with this? And would it be at home or entering quarantine camps? And what kind of place would you have? Would you quarantine at home for Hong Kong residents? Would you provide them with bracelets? And would you have enough of those? And it was implemented on 8th of February. You worry that a lot of people will, or a large group of them would swarm the borders within 2 days. If they're not showing symptoms, would it be posing risk to the community? If these measures are implemented 10 or 20 days earlier, and would the situation be much better than today? So why we have to wait till now to launch these measures? Is it too late? And the third question, I'd like to ask on the healthcare staff, and earlier that you asked them to be frank. However, they have requested multiple times for open dialogue, and so why did you choose not to attend the dialogue with them? Let me answer the third question, and now I'll pass over to Professor Chen. So there's a union within the hospital authority that decided to take industrial action or refuse to return their posts. Well, that will fall under human resource management. That, like I responded last time, the best would be allow the senior ranks of the HA, including the chairman and the CEO, to meet with them. The chief executive would also relay their views to me. And since the CEO had met with me and very willing to continue meeting with them, I would see them as the more appropriate way. Another consideration, I noticed that the demands of the employees allowance, I don't see their objective being different from ours. From the public health and contagion control perspective, we very hope to reduce the cross-boundary flow, so allow us to further curb the spread of the contagion and the virus, and also reduce the workload of the hospital authority. So we know aware of their demands, and we've been working along this direction. Just like they said, there is sufficient protection gear, for example, a face mask and protection suit. That I repeatedly stressed that we would put the demands of the requirements of the staff on the top place. So a lot of their demands have been noted and also belong to our line of work. I now pass over to Professor Chen to talk about the quarantine.
或者我都我剛才咧都所講咧，就話具體嘅安排咧，我哋都會稍後咧就係會詳細咧同大家交代嘅。但係最緊要咧就係第一咧，我哋都會係提供一個訂立一個新嘅附屬法例。咁呢個就令到我哋咧係可以提供一個法律嘅框架，對於呢一種係強制自我檢疫嘅安排咧，係可以有一個法律嘅框架。第二咧就係喺我哋啲口岸咧。一般嚟講咧，所有嘅口岸嚇，而家入境嘅人士咧，其實佢係香港居民同埋唔係香港居民咧，都係需要接受強制嘅檢疫14日。咁剛才行政長官都講過，喺我哋入境嘅人士咧，我哋都發現咧，其實係大部分咧都係香港嘅人士要。
As the Chief Executive pointed out, for most people arriving in Hong Kong, they are Hong Kong residents. They just have to commute between Hong Kong and the mainland. As for people coming from the mainland or other countries, they account for a small percentage. But then for Hong Kong residents and non-Hong Kong residents, they will all be subject to mandatory quarantine. Well, as I said, we will give you the details later, but what is important is that you should know the outbreak remains serious on the mainland. And in Hong Kong now we have identified a few locally infected cases. We have reasons to believe that there will be more local infection cases. That's why we need to take resolute measures. So for those who carry risk, they will be subject to mandatory quarantine. Apart from mandatory quarantine, there are other measures in place as well. For example, at the control points, there will still be the requirements for health declaration, body temperature checks, and then there will be Port Health Division colleagues manning the control points. And also for local infection cases, since we've seen a few, so we know there will be an increasing risk for local transmission. That's why the hospital authority has made preparation for designating clinics. They will activate the designated clinics in the various hospital clusters when the need arises immediately. So then we'll also relieve the pressure on the accident and emergency wards. For these designated clinics, they will mostly deal with the milder cases so that hospitals and the A&E wards could focus on the more serious cases. For these designated clinics, they would also help to identify infection cases in the community, and that will help to further reduce the chance of transmission. Tomorrow there will be a press conference to explain the details. Now, if I may add further, well, of course, we cannot tell you at this point precisely that after the implementation of the new measure, how many Hong Kong residents or foreign visitors will have to go into mandatory quarantine. But this is a stringent measure. As soon as you arrive at Hong Kong, you have to be subject to 14 days of quarantine. Now, we have consolidated border control points. With that measure, it's just that is inconvenient for you. You close control points A, B, C. You can go to D, F. Now we even close D, so people have to go to control point E and F. Now, on the 29th of January, before we even suspended the first batch of border control points, there were 700,991 arrivals through all these borders. And yesterday, it dropped to 28,675, so less than 20%. So I believe now that we implement this new measure that starting from midnight on the 8th of February, people have to be subject to 14 days of quarantine as they arrive in Hong Kong. I'm sure the arrival number will drop further because it's just common sense and most people wouldn't want to be subject to 2-week-long quarantine. So therefore, from this point of view, we believe we do not need to deal with a large number of mandatory quarantine cases. But I must still say this. It's especially true for Hong Kong residents because now over 80% of the arrivals are Hong Kong residents, and we still have over 10,000 Hong Kong residents leaving the border every day. So here I must appeal to all Hong Kong residents. We must work together. Please support this strategy in fighting the outbreak. Now, please reduce your travel to the mainland or avoid going altogether, and that will be easier for us to fight the outbreak. Now, some ask how come we will only implement the measures in 2 days. Well, we have to bear in mind the ties between the mainland and Hong Kong among the people. There are people who need to go to work or to take care of family members, young children, and so on. So that's why we do appreciate that we need to provide more support to those who face difficulties, and then they will rest more assured not leaving Hong Kong or coming to Hong Kong. And that's why I said just now I have asked the Secretary for Law for Labour and Welfare to come up with certain measures. So perhaps he could tell you quickly what he's planning to do. Thank you. Now, if you just come to Hong Kong for sightseeing, and then you have for a few days, and then you will be, put, quarantined for 40 days, probably you won't want to come. But then there are two types of people: those who need to cross the border, go to work, or a family member split between two places. There may be a need for them to fly between Hong Kong and the mainland. But as you know, in the past week, for affected employers and employees, they have already considered the risks of their employees going between mainland and Hong Kong. So if starting from Saturday, we implement measures of the 14-day mandatory quarantine, then for people who live on the mainland come to Hong Kong to work, or for people who live in Hong Kong and have to go to the mainland for work, they will be affected. So that's why we are allowing 2 days to give room for employees to make suitable arrangements. So we will actively look into possible measures. Let's say there are some who cannot make a work arrangement. For example, they cannot stay home to work. And then there are employees affected this way. Then we will provide them with assistance. And the second type I just mentioned are families with members split between the two places. Maybe they need to take care of elderly parents or young children. So again, with this room of 2 days, they could make arrangements. But again, if at the end they are not able to make any arrangement, the Social Welfare Department could provide assistance if necessary. For families in need, please call the Social Welfare Department hotline 2343-2255. Thank you. Last two questions, please. The lady in the black jacket. Good afternoon, Mrs. Lam. I'm from Ming Pao. Would you consider requisitioning Disneyland Hotel or the vacant site next to Disneyland? Or what about the Shek Kong Barracks? Now, you say you will give time to school children and families who need to cross the border to make arrangement. But are you concerned that you would actually add to the risk of community outbreak as a result? Now, for the second question, we are actively looking into various options to increase the number of quarantine centers. So far, we have still the free holiday camps. We've been approaching most of the holiday camps because mostly it seems that for most holiday camps, their location is acceptable to the public in general. But then I must add that for most holiday camps, they are not suitable for use as quarantine centers because maybe they don't have enough rooms or it's not easily accessible by car. We're also asking the Development Bureau to find vacant sites. Maybe through certain ways we could add more facilities. But today, really, we can't announce any details on additional locations for use as quarantine centers. Well, that's one. Originally, we could activate the camp in the next few days. That's the Zhao Chongyi Academy. Let me appeal to the local residents again. Please be accommodating and understanding. Please allow us to use the academy facilities as soon as possible, because that will help to boost the number of quarantine facilities by a good measure. Now, about the implementation date of the measure at 0 hours on the 8th of February, as Dr. Lo Chi Kwong said. But I think by now, for people who have to cross border, it's because they do need to do so. I wouldn't say there are still, leisure travelers. If there are still so many Hong Kong residents who have to cross the border now, that must mean that they have a genuine need to do so. So we need to give them time to sort out the arrangement. Now, would it then create a window for increasing the risk of outbreak? Well, that may not necessarily be the case. It's like for now, it's just as the people were concerned that what if we have fewer control points, that everybody would be rushing to the same control point. That did not happen. We're not seeing any a significant increase in the number of arrivals at the remaining border control points. So it's not the case that traffic from other control points like Low and so on has been directed to the remaining 2 control points. So that's why we have considered all the factors and that we've come to this arrangement. Now we need to give a little bit of time for those who will be affected to make arrangements. At the same time, we need to proceed with the legislative exercise. And then we also have operational matters that need to be addressed in relation to quarantine, because if after the legislation comes into effect and we're not able to implement the quarantine management, it will not be desirable.
Last question.
Morning Post, you highlighted the need to reduce contacts in the community, and you announced earlier that civil service will work from home until February 9th. It's only a few days away from that day. Will you extend further that arrangement? And second question is, a friend of my colleague who is a public hospital doctor said the isolation ward in Princess Margaret Hospital have been occupied. Are there any other measures the government is going to adopt to handle this? Thank you.
Thank you very much for the question. Yes, we need to enhance social distancing, as this is one of the important strategies. Now, especially, we are seeing some community-based infection. I am not yet in a position to announce the exact arrangements for civil service after this week, but it is likely that we will have to extend it. But of course, again, it is a matter of balancing, because many people in Hong Kong or many operation of businesses still require some very essential and basic services. So, but as I now see it, because I said the next 2 weeks will be rather critical, so there is a high chance that we will have to extend this work from home arrangement, and we will announce it as soon as possible. As far as the isolation ward in the Princess Margaret Hospital, in fact, it is not just isolation ward. The hospital authority has been under extreme pressure in almost everything, in terms of facilities, in terms of manpower, in terms of supplies, in the protective equipment, including surgical masks. So we are doing whatever the hospital authority needs to help them to overcome this shortage. And that's why I really make an appeal that staff of the hospital authority at this very critical juncture and very challenging times should continue to support the hospital authority, as well as other healthcare professionals who are now working so hard in order to ensure the provision of services. But whether we have very specific proposals to tackle the isolation facilities, I see whether Professor Chan has something to add to that.
Okay, first of all, as far as the current isolation facilities is concerned, its occupancy is about 40%. The hospital authority, other than the Princess Margaret Hospital ID block, that is the infection disease block, there are also other isolation facilities in in a number of hospitals in these 7 clusters of the hospital authority. So this is something that obviously the hospital authority is looking at, and also at almost like real-time monitoring and see how they can work towards the increasing number of cases. On the other hand, in order to relieve or the hospital authority capacity and to provide them with a situation, in particular, the Accident and Emergency Department, they are quite ready to embark on the designated clinic, the running of the designated clinic, because as we are seeing these cases in the community that may not have a previous travel history. So we are very vigilant in terms of looking at there may be cases already, in the community, in community infections. And in order to further reduce the risk of community transmission, then it is important for the hospital authority to actually identify, to continue to contain, the situation, and have early identification of the cases. And so the designated clinic will be tackling cases that have of a milder situation, and so that allow the hospital as well as the accident and emergency departments to treat and to deal with the more severe cases and also the suspected cases. And so these designated clinic objective would be able to find or identify some of these cases in the community that may have the virus, so as to reduce the community transmission chance. So we will be having more details, for all of you about the designated clinic. The hospital authority is ready, but then we would have to look into when is the best time to execute or start the running of the designated clinic. So we will be having further information tomorrow.
今日記者會到呢度。
End of the press conference. Thank you for coming.
係咪後知後覺同埋對疫情唔上心咧？14日嗰個強制嘅。